Well, we have to talk about our city's crime crisis. Yesterday morning, we took you to the scene at Motel 6, where Albuquerque police were investigating the 99th homicide of the year.
So we took our questions to Police Chief Harold Medina, and he says that APD is working on some solutions, but an end to the violence, he says, needs to start in our community.
Culturally, we need to change as a community and as a country. And, you know, the amount of individuals carrying firearms, it needs to become something that is completely frowned upon.
Chief Medina says his officers are identifying common threads between violent crimes like the ones happening at motels, and APD is encouraging businesses to install license plate readers. He also says there are talks to bring back APD's party patrol after several deadly house party shootings around Halloween. So in our last hour, we talked about how gun violence is impacting not just our police officers and investigators, but healthcare workers on the front lines.
Yeah, Joy Wang here in the studio. Joy, these healthcare workers, we know they're already so stretched thin.
They are, and we are still in a pandemic. Well, Dr. Steve McLaughlin, the head of UNM Hospital's emergency department, says COVID-19 and gun violence are actually the two biggest public health issues going on right now.
The reason why gun violence has become something I'm really concerned about over the past couple of years has been, number one, that it's becoming more common. Number two, having seen the toll it takes on the patients if they survive or their families. And the third one is that I think we have an opportunity to do better at preventing it.
Just yesterday, we reported on Albuquerque's 99th homicide investigation, but for the state's only level 1 trauma center, they're looking at all the other cases of gun violence that don't always make it onto the news. We're talking injuries almost on a daily basis, people who survive gunshot wounds but never really get their life back.
Impact of that for the patients that survive is also huge. Some of these patients have spinal cord injuries. They may be paralyzed. They may have abdominal injuries that result in permanent changes in their physiology, and they may need, multiple surgeries, and the recovery can be really long.
And it's not just the person injured who's a victim. Family members also having to take on that extra responsibility, both physically and emotionally.
The psychological trauma of having this happen is really tough on people. So there's the impact that it really changes a person's life even after they survive.
Then there's the trauma our healthcare workers are also dealing with. Again, all of this is happening during a global pandemic. Healthcare workers not just dealing with a lot more death because of COVID-19, but also increasing gun violence across the country.
What we're seeing across the country is that a lot of people are choosing to exit the career, and so that's been a real challenge. And the folks that are staying in healthcare, we're spending a lot of time really trying to support people, really focused on mental health, trying to reduce the stigma of healthcare providers asking for help if they need it. And there's obviously high levels of depression and PTSD in healthcare workers during this time as well.